Hello, my name is Natalia Klimek, and today's date is the 8th of February of 2022. And for the Unit 2 Case Connections assignment, I chose Case 2 along with Case 4. So for Case 2, a 16-year-old female is recently diagnosed with a deficiency of muscle glycogen phosphorylase. She and her family are concerned and ask the following questions. So first of all, the deficiency of muscle glycogen phosphorylase is a glycogen storage disorder, and there is usually an absence of the enzyme. Due to this deficiency, there is an inability to convert the glycogen to glucose, which then causes an accumulation in the tissues. And then usually this disease is known as McArdle disease. So the first question that if they ask, I'm not sure I understand the issue. Can you explain how muscle glycogen is used normally during exercise? So basically, normally during exercise, the glycogen that is stored in our body from glucose previously is stored in the muscles and is converted to glucose 6-phosphate and then converted into free glucose to use for energy, especially in the fast state. Anytime someone does any exercise, the glycogen will be converted from the muscles, then the liver. Number 2, I really like to take long walks while I still be able to do this with my friends. So with this disease, the cause of the inability to produce glucose from the stored muscles will cause muscle weakness along with loss of mass in the muscles. It would not be recommended to take long walks, but before any exercise, it is recommended to have a snack high in fructose or high in carbohydrates, which can then reduce any symptoms that they may be experiencing after. Number 3, as a result of this deficiency, I need to get up at night to maintain my blood glucose levels. So it shouldn't be necessary to wake up at night to check blood glucose levels because your body is not in an exercise state. So it won't be trying to use the stored glycogen that is in the muscles. However, in bad cases, when the body has been in a fasted state for a while, it might be important to check blood glucose levels then and eat something that will benefit. However, it really does depend on what kind of state you are in and how bad the symptoms are. It's important to consult any doctor in this and then also just follow a nutritional plan with them and stay cautious with them. And number 4, do I need to worry about producing excessive lactate during intense anaerobic exercise? So during any anaerobic exercise, blood glucose is converted to lactate. However, due to the deficiency of the enzyme in the beginning phase of the glycogenic cycle, there will be no lactate levels produced or increased. However, it has been shown that the amount of lactate levels released is a similar amount to healthy individuals. So overall, this disease shouldn't affect someone's day-to-day life, except if they are exercising a lot, then they just will need to be more cautious in what they eat and when they eat it as well. So the second case that I have chosen was case number 4. And it is a previously healthy 2-month-old female presents with jittery spells several hours after breastfeeding. Her mother reports that she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours between feedings, and that's when the mother reports these symptoms started. Laboratory results are consistent with hypoglycemia, which is low blood glucose, but are otherwise unremarkable. Epinephrine is administered and there is no increase in blood glucose, but there is an increase in blood lactate. Also, a physical exam reveals a liver edge 4 centimeters below the right costal margin, along with percussion of the right chest and abdomen confirms an enlarged liver. The blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within a normal range during fasting. So first and foremost, glucose is a huge supplier for our body. When we intake any glucose, the body uses whatever amount it needs to function, but stores the rest in the liver and the muscles. The liver converts the glucose to glycogen through glycogenesis, while the glucose that is used for energy undergoes glycolysis. Once the body needs more energy and is in the fasting state, it will turn to the liver and muscles for the glycogen supply. The glycogen is turned back to glucose through glycogenolysis using the enzymes glycogen phosphorylase and phosphorylase kinase. So with all the answer choices here, I believe that it is the glycogen storage disease, which is the inability to use glycogen. Glycogen storage disease is a hereditary disease which is caused by a lack of an enzyme to break down the glycogen in our body. There are several different types of glycogen storage disease, but it seems that this patient is experiencing type 1, which is a deficiency in the enzyme glucose 6-phosphatase, and which breaks down glycogen to glucose. Due to this deficiency, though, it can cause lactic acidosis and hypoglycemia. So symptoms of this disease are enlarged liver and kidney, high levels of lactate and uric acid, hypoglycemia, which the patient is experiencing, all three, and then impaired growth and ulcers of the mouth, but the patient's not experiencing that. And then for the other answer choices, galactosemia, which is the inability to convert galactose to glucose. Those symptoms are mainly vomiting, jaundice, and edema, and the patient's not experiencing any of those, so I was able to cross that one off. For the hereditary fructose intolerance, that's when it's the body's inability to digest sugar fructose. And symptoms for that are growth impairment, hypoglycemia, nausea and vomiting, diarrhea and jaundice. Also, the patient isn't really experiencing any of those. And then the last answer choice was glucose 6-phosphate dehydrogenase deficiency, which is basically when red blood cells break down when they're exposed to any certain foods or bacteria or any other chemicals. And a patient doesn't experience any symptoms unless the red blood cells are exposed to those things. So if they were, they'd experience dark urine, fatigue, and jaundice. And in this patient's case, they're not experiencing any of those symptoms. So overall, in the 2-year-old's case, when glycogen levels fall between feedings, there's no way to maintain the glucose levels due to this deficiency. Along with the glycogen storage disease, it is more prone to babies around 2 to 4 months old to get it as well. But that is all. Thank you.